When you're sick, you just want to feel better, but how far would you go to be well again? One controversial treatment is making headlines. Take a look.
Americans use hydrogen peroxide almost every day, from disinfecting things to bleaching our hair. But would you inject it into your bloodstream? Some naturopathic doctors are doing just that with a saline solution that contains 3% hydrogen peroxide. The unproven treatment claims that acid helps to kill things internally and is used for MS, viral infections, and even cancer. The FDA has never approved such treatments and are calling on these holistic doctors to prove it works or stop doing it. Americans are always looking outside the box for different ailments. But isn't injecting potentially toxic substances going too far?
And we actually have joining us in the audience today osteopathic family physician Yoshi Rahm, who provides this treatment in his clinic. And the first question I'm going to have for you is, given the fact that there's no scientific evidence at all that this works, could potentially cause harm, why?
No, the truth is, my goal in life and my profession is to really serve people. I take very seriously the Hippocratic Oath, which all physicians have to take before we get our diploma, is first do no harm. I wish there were more studies. I wish there were a lot more studies because there's very little studies on this. Does that mean it's a horrible treatment? No, it doesn't. Wow. There's over 100,000 sessions of it done every year in the US. It's been going on for year after year, decade after decade. That adds up to millions of treatments. Everything in medicine is a risk versus benefit. Everything should be, whether we're prescribing ibuprofen or Paxil or IV hydrogen peroxide.
As I was reading and preparing for this story today, I read that this is even prescribed for people who have MS. And my mom died from MS, and I have a very good law school friend of mine who's in the really thick of his MS. And the first thing I was going to do was call him and tell him about this. And then as I kept reading it, I got really nervous about that. And I didn't think that was a good idea, and I didn't do it. And my question to you is, are you telling patients like my mom who have serious illnesses, that there's no science? That this isn't FDA approved? Are you full disclosure, transparent with your patients about that? Because I'd want to know that before I tell my friend to try this.
I take very seriously describing the risks and the benefits of as many therapeutic modalities as I know about. That's just how I operate.
But you said
I'm sorry to interrupt, but just question though. So when there are conditions like horrible, devastating diseases like multiple sclerosis, I looked at multiple forums online where people were touting this for everything from viral illnesses to cancer. There are other treatments. There are FDA approved, backed by science, where there are randomized clinical trials that support the use of medications. Are you offering your patients those options first? Like, how do you even present this?
Yeah, absolutely. First of all, somebody with MS, I'm always going to refer them to a neurologist. Like, I'm a family physician. MS is not my specialty. I've only treated one person with MS with the IV hydrogen peroxide in my office. She had what appeared to be a very good result from it. So I'm a fan of science, double-blind, placebo-controlled trials, of course. I love that. But I'm also a fan of common sense and decades of people's experience, physicians, doctors' experiences over the prior 20, 30 years.